Mr. Barton.
I have an amendment at the desk on physician-owned hospitals to this title. I believe it's number 22. I wouldn't swear to that, but I think it's number 22.
Amendment offered by Mr. Barton. At the end of Part 2 of Subtitle C of Title 4, add the following. Section 4315.
Mr. Chairman, I would ask unanimous consent the amendment be considered as read.
Without objection, the gentleman is recognized to explain his amendment for 2 minutes.
Mr. Chairman, very briefly, this amendment just preserves the option of our constituents who wish to go to a hospital that is owned and operated by physicians. Most of the hospitals in this country that were started in the very beginning of our nation's history were hospitals or clinics that were started and operated by physicians. For some reason, the new Democratic majority has decided to try to obliterate one of the areas of the healthcare sector that is being most innovative, most cost-effective, and most quality-conscious. So all this amendment does, Mr. Chairman, is simply reserve the right of our constituents to go to a hospital that is owned by physicians. It would allow for those people that receive Medicare to have Medicare reimbursed services that are provided by these physician-owned hospitals. It's a very good amendment, and I would ask that it be adopted.
Will the gentleman yield?
Oh, I yield to Dr. Burgess for 15 seconds.
And I thank the gentleman for yielding. This is an extremely important concept, and Mr. Chairman, with your permission, I will submit for the record an extremely insightful article that was published in Health Affairs March 24, 2008, written by a member of this committee, which detailed why this concept is so important. There is nothing like the pride of ownership, and for a physician-owned hospital or ambulatory surgery center, you want things done right because, after all, it's yours. One of the things that we have the least amount of in the practice of medicine is time, and we are able to control the time much better in an ambulatory surgery center or physician-owned hospital as opposed to an investor-owned hospital, and I won't mention any initials, but you can imagine who that might be. So I do want to submit this for the record if there's no objection, and I strongly encourage support of this amendment.
Without objection, the full statement will be made part of the record. The chair recognizes himself in opposition to the amendment. This would repeal a provision in the Children's Health Insurance Program reauthorization before it even clears both houses, and that bill closes a loophole in Medicare law that allows physicians to refer patients to themselves. The current physician self-referral law includes an exception that allows for ownership in a whole hospital but explicitly prohibits ownership in a subdivision of a hospital. And the CHIPRA, Child Health Insurance Provision, would not prohibit physician ownership, but it would simply ensure that those physicians could not refer their patients to hospitals in which they have an ownership interest. If a physician can benefit financially by referring patients to an entity in which he or she has an ownership interest, there's clearly a conflict of interest. That's why this provision that the amendment seeks to repeal was strongly supported by the American Hospital Association and the Federation of American Hospitals. The provision in CHIPRA would save $260 million over 5 and $1.24 billion over 10, reflecting CBO's and MedPAC's assessment that the incentives inherent in these ownership arrangements increase the use of health care services. So I would urge members to oppose this amendment and yield time to Mr. Pallone.
Mr. Chairman, if I could just add, I mean, the CHIP bill, which includes this pay for, which essentially would be repealed if this went first, was passed by over a 2/3 majority in the House last week or 2 weeks ago, and it had a lot of Republican support. So, I think it doesn't make any sense to undermine what the House has already said they support, including a lot of Republicans. I yield back.
The time has expired. All those who are for this amendment, we're going to do this by a roll, not by a roll call, but a show of hands. All those for the amendment, please raise your hand. The clerk will tally. All those opposed to the amendment, please raise your hand. I don't know if he wants to. I don't think he wants. The clerk will report the vote.
On that vote, there were 10 ayes and 30 noes.
Yes. Well, this is not a roll call vote, but a show of hands.
31.
There are how many?
10 ayes and 30 noes.
10 ayes and 30 noes, and that might be changed here or there, but not enough to make a difference by members who would have liked to have been clearer on record. The amendment is not agreed to.